I think those viruses were just waiting for some sort of gap in order to take advantage, and we're seeing that now.
Respiratory illnesses of all kinds on the rise. Doctors in our area say COVID-19 remains the most common and most severe respiratory virus right now, but there are others making the rounds as well. WRTV's Megan Sanctorum spoke with doctors at IU Health to find out what you need to know to keep yourself and your family safe.
Doctors are calling it a summer spike. Respiratory illnesses caused by viruses are on the rise. Experts at IU Health say the reason for that could be relaxed COVID-19 precautions. People are not wearing masks as often as they were before, and people are beginning to travel and gather in large groups again. IU Health says COVID-19 is still the most common and most severe diagnosis for respiratory illnesses right now, but symptoms can be similar to other viruses.
Number one is respiratory syncytial virus, or RSV. We're generally exposed to it as kids, but can get it as adults as well. And we are seeing that a lot in the Midwest right now. There are some other respiratory viruses that are starting to go up as well, or have been going up throughout the last month: parainfluenza virus and human metapneumovirus. All of these viruses cause syndromes that are very similar to COVID. COVID still remains the most likely diagnosis for someone who develops a fever and respiratory symptoms. It becomes less likely in patients who are vaccinated, but not extremely low likelihood. So I would still recommend even vaccinated individuals get tested for COVID if they develop, fever, cough, trouble breathing, any really upper respiratory signs or symptoms, in order to make sure that if you've got COVID, you know it and you can isolate yourself and protect people from getting infected from you.
Working for you, Megan Sanctorum, WRTV.
Well, some key data tonight showing the impact the pandemic is having on Indiana. The State Department of Health reports an increase in new COVID cases, a rise in the 7-day positivity rate, a higher number of hospitalizations, and 13 new COVID-related deaths, which is also more than what was reported on Monday. Health experts have said these increases are impacting the unvaccinated a lot more than those who are fully vaccinated. And this further underscores the importance of the vaccine. We're talking about breakthrough cases here. This includes any person who has tested positive for COVID at least 14 days after their final vaccination dose. So far, the state has seen more than 3,700 breakthrough cases. Well, that's less than 1% of everyone who has been fully vaccinated here in Indiana. There have been 56 confirmed breakthrough deaths. Again, that number doesn't even come close to 1% of everyone who's fully vaccinated. Doctors say this speaks to how effective the vaccine has been. If you want to register for a vaccine, just go to the website ourshot.in.gov or dial 211. Many clinics also accept walk-ins.